Hi, everybody. Good morning, good afternoon, good evening, and thank you so much to spend your time and joining our Insight Sharing Talk today. And today is a beautiful day for Ha and I. We met a wonderful person, Professor Sir Cary Cooper. Hello, Professor.
Hello, Vivian. Hello, how are you both?
We're
You're
good.
doing so good.
How about
Yeah,
you?
Good, that's what I want to hear.
And how
yep,
about
and
you?
wonderful and honored to meeting you, sir. Yeah.
Okay, my privilege.
Well, thanks for allowing us to call your name as Carrie as well. So please allow us to take you through the entire journey, how everything started. From our culture, it's our honor to have our speakers to introduce about themselves. And would you please help to share with us a bit about yourself, Carrie?
Oh, sure, absolutely. Well, I was born and raised in Los Angeles, California, but my parents were Eastern European. So my father was Ukrainian and my mother was Romanian. And my father came from the Ukraine, but he thought it was Russia because at the time he was born, there was no Ukraine. It was a part of Russia. He was born at the beginning of the 20th century. My parents were both Jewish, so they encountered quite a lot of discrimination. In Russia, there was the Tsar, who was fairly anti-Semitic, and they had all these what they call pogroms. They used to go into the Jewish communities and cause havoc. He wanted to get rid of the Jews. Basically, I think quite a lot of a number of Jews were involved in the communist movement of the time. And I think the Tsar didn't like that. And, anyway, my father then left and went to Canada, and then from Canada to Los Angeles. My mother was Romanian Jewish. And in the First World War, when the Germans invaded Romania, again, they were fairly anti-Semitic, so they had to get out. And unlike my father, they had more money, so they could use the money converted into jewels, so that they could get out of the country and put it in my grandmother's corset. They took the stays out of her corset and put the jewels in a hid them, and then paid their way across Europe and then into the United States. My father, on the other hand, was very poor, came from a very poor background, and he had to walk 2,500 miles from the Ukraine all the way up to Murmansk to get a ship, to take a boat, which then went to Canada. Anyway, they both had very difficult early lives. They then met in California and ended up having 5 kids. So that's how my life started. And I was in California, and I guess the most influential part for me being raised, nobody in my family had gone to university ever. So I was the very first one in my whole extended family to have gone to university, and it obviously changed my life pretty dramatically. But I always knew where my roots were, from a working class background, and how important that was to me, to make sure that whatever I did, I was helping other people, because I saw my family and what they had to put up with, and various people in my family lost their lives in the conflicts and wars and things that happened to them, or even the Great Depression of the late 1920s. So I always kept that with me. And then most of my friends were Eastern European too. There was kind of a community in Los Angeles of Eastern European Jews who had to flee German invasions or the pogroms in Russia or wherever. And we were all together, and most of them, their parents wanted us to go for higher education, go to university, make something of ourselves. And I thought I was going to become a lawyer. Like all my friends are lawyers or doctors. And I had to work because my parents didn't have, my father was a hairdresser and didn't have very much money. So I had to work my way through high school, through university. And one of the jobs I had when I was at university was being a social worker in the city of Los Angeles for the very deprived Black community of Los Angeles, and also with the homeless in the city of Los Angeles, in the downtown city of Los Angeles. And I saw such deprivation, and I thought, I can't be a lawyer. I just can't do this. It might make me comfortable, give me a comfortable life. I have to do something different. And I got exposed to psychology, and I got exposed to the issues of mental well-being, and from an early age. So I think that influenced me pretty dramatically. I got involved a bit in the civil rights movement. I was involved, I should say this, I was involved in the anti-Vietnam campaign as well, very much involved in that. So I was on marches for both civil rights, anti-Vietnam war, and all of that stuff. And then I met a professor from England who was visiting UCLA, where I did my undergraduate, my MBA, University of California, Los Angeles. And he said, why don't you come to England for a year? And I came, this was 1964, and I've been here ever since. And I made it my home. Because I feel kind of comfortable in Europe. I like the value systems of Europe. Value systems of looking after people, of a national health service. And that to me is important. You don't get that in the United States. There is no national health service. People can go broke if they get very ill. So I felt the values, I felt closer to it. Maybe because my parents were European. Maybe because all my friends were from European backgrounds, Eastern European backgrounds. So I think all of that made me, being a social worker in the city of Los Angeles, seeing such deprivation, and, figuring I have to do something. And then I just did a PhD in workplace psychology, more or less, organizational psychology, HR, that kind of thing, and just gravitated toward mental health. I don't know how exactly. I saw very senior people suffering. I did a big study. Wasn't doing it on stress, but I did a big study of very senior managers in a global company, because I was trying to find out why these people were refusing promotional moves to other countries. And they would say to me, well, I don't need the stress of it. I have a young family. I don't need this. Even though it's promotion and it's big money, the stress will kill me. And I kept hearing the word stress. And then I I went back to the big global company that hired me in to do a piece of work as an academic, a piece of research. But it was not stress. I said, well, I'll do that for you for nothing, if you let me give access to all your senior people, the top 200 in the company. It was a big global company. And I want to find out what their life's like. What is work doing to them? What's it doing to their families? And that was my first study. And then I wrote a book on it, published lots of papers. And then all of a sudden, everybody was talking about the word stress. This was in the 1970s, 1980s. And then I was doing air traffic controllers, pilots. I've done something like 85 big occupational groups, teachers, doctors, nurses, you name it, I've more or less done it. International interpreters working for the UN. So I've done quite a lot of studies on what's your life like? What's the job like? What's it doing to you? What can we do about helping that? How do we help employers create the right kind of environment for people so it doesn't burn them out, doesn't get them sick, that it makes them feel valued and trusted? And I think that kind of simplifies in a way my career. Once I got into that, I realized that work can be very stimulating and motivating, but it can also damage people. Wow. And it's about creating the right kind of culture in work environments, whether it's an IT company or a hospital or, pilots on a plane. It doesn't make any difference. We're all people who work to make a living, and if it gives us a sense of purpose, makes us feel valued and trusted, people will produce for you, but they won't get ill.
Wow.
And I guess that's been what I've been trying to do all my career.
Wow. Cary, thanks a lot for sharing, an abstract of your life and the works that you've been doing. And this conversation today, we're gonna dive into it in a deeper, and to make sure to figure out the moment in your life that you decide to go into, a career, of helping people with mental health, being in the psychology world, and with that leading to many great contributions from your works in this field today. All right. So the first thing that I want to ask you is about when you were young. You said that you wanted to be a lawyer because your friends, a lot of your friends also back then, either want to be a lawyer or a doctor, right? Um, but why in your head back then you thought of yourself becoming a lawyer? Can you share with us that?
Yeah, sure. I think really my parents, none of them who went to university or had the opportunities to go, they wanted me to be a quote professional man, whatever that meant. And all my peer group were the same, boys and girls who came from Eastern European Jewish backgrounds. We went to a high school that was really into, and it was 95% Jewish. It wasn't a religious high school. It was just a normal state school in West Hollywood. But it was very academic, pushing kids, be successful, be a professional, be a doctor, be a lawyer, be a engineer, do something like that. And given our parents, invested in us to do it, we worked hard. All of us, almost all my friends, worked all the way through high school in jobs because we all came from relatively low income, very low income families. So we had to work, which was good for us. And I think somewhere along the line, I thought to myself, here are all my friends. I must have had a dozen friends, all became lawyers. I thought, what's the normal laws of probability that this is what they should do given their personality type? They were doing it for their parents. And I thought, I won't be happy in this. It just won't make me happy. And I noticed as my friends were going through their studies, they didn't particularly enjoy it either. I had a friend of mine who became a very senior lawyer, but he was unhappy, went through 2 or 3 marriages, because he should have been a historian because he was really very clever, very history orientated. And I thought, as I was just going through that, and then I guess another event occurred that made me change my mind too. When I was doing after I did my degree, before I went to do my MBA and then a PhD in England, but just before I did that, I had to go into the military, right? I went into the Navy Air Force Reserve, all right? And guess what happened while I was in? So I was in for active service for about a year. Everybody had to, in those days, everybody had to go into the military, all right? And so I went into the reserves because I didn't want to go in for 4 years as an officer. I just wanted to do my time and get out and then do something with my life. But when I went in, there was the Cuba crisis. Do you remember that?
Yeah.
You're probably both too young. Probably the listeners are all too young. I'm that old. But the Cuba crisis was that Khrushchev was heading a ship with missiles to put in Cuba, which would then aim at the United States. And I was being trained in photographic intelligence, right? You had to have training in something, right? It could be repairing aircraft. I wasn't an officer. I was just an ordinary sailor. And I thought this could be the end of the world. I don't think people realize that could have been nuclear war.
That
Everybody thought it was going to be, because we thought we were inches away from a nuclear war. And that changed me, made me think. And I was in at the time, and I heard what was going on even more than normally you would have heard, because I was doing photographic intelligence work at the time. No, I wasn't doing that work. I was being trained to do that. But we all knew what was going on. And I think that affected me, because I thought to myself, this is one life. My life could end with this war right now. All of us could have ended our lives, more or less. We could have blown the planet up with that incident, even more profound than the Vietnam War, any other war. So that affected me.
Wow.
As well. I thought, that's it?
Yeah.
No way. No way am I becoming a lawyer. I don't know what I'm going to do, but I'm not going that way. I'm not going in that direction. So when I left the military, I served my year and then had to serve as a reservist. I then did an MBA. So I think what ended up happening as a result of the Cuban crisis was a kind of reflection, a rethink about what life was all about, given the fact that, this was potentially a global catastrophe. And I just started to think to myself, and it was really funny because I had a girlfriend at the time who I thought I was going to marry, and I had been, I've been in the Navy, Air Force Reserves, and came home. I was given a weekend off before, as the ship was heading toward Cuba. We had to go back after that, but you're given a week home to go see your parents. It was quite frightening time. And I remember my girlfriend saying to me at the time something like, I said, no, I'm not going to be a lawyer. I'm not going to do this. That's not what I want out of my life. This life is too short. We're seeing what we're in the middle of now, right? This is too short. And I remember her saying, well, I think it's really, it's important you have a good job. And I thought, this is not a relationship for me either. So I thought there was something wrong in that relationship, that what I ended up having to do had to please her. I had to be a nice professional man. It was kind of personal in a way. It was like my parents asking me to be a professional. And then my girlfriend, who I thought ultimately I might marry, was saying the same. And so our relationship broke up. And in a way, it was very liberating, because now I thought I can do whatever I want to do. That's when I went back to university and did an MBA, but a behavioral science MBA, where it was all about psychology in the workplace, sociology in the workplace, finding HR, what's going on? How do we create how do we make life nice for people? How can we be kind to our employees? It must produce to the bottom line in the end anyway, if we treat people properly, rather than burn them out. So I think that was another defining moment.
Wow. So Cary, when you came back from that event, right, and then you decided to go for your MBA and changing the world, you could be doing any kind of career. You can be in, like international politics, right? You can be in economies, be in the communications, marketing, whatever. You can get the message across, right? But why psychology?
Okay, I'll tell you why. Is because most of us in the workplace play a role. You're an HR person. You're a finance person. It's a role. We play roles, but we're all people. We have families, we have kids, we have relationships. Relationships break up. All sorts of things happen to us in our life. And yet we go into the workplace and we play this role out. And because we have to play that role, we can't necessarily be who we are. We can't tell people we're not coping. We pretend that we are all really great copers, that life is glorious. We take our selfies. We pretend a lot. And I think a work environment where people get to know other people as human beings. And the good news, I think, during the pandemic was a lot of people were working from home. We're all locked down. You were you're the same thing in Vietnam, right? And what ended up happening, I thought, which was really good, is that people were sharing a lot more about their life virtually when they were having meetings virtually. And I thought that was really an excellent thing to have happened, funny enough.
Yeah.
People would start a meeting online with all their colleagues scattered in their own homes. The dog would come up, a child would come into the room. People would say that their wife has COVID and is in bed, and I'm worried. People all of a sudden started to become, strangely enough, virtually probably more human, more humane and human. We knew more about people than we did when we were all going into the office, playing our roles out. And I thought that was really very kind of healthy. I just hope we don't forget those 2 years and learn from those 2 years. We've learned a lot in the workplace. We're now working virtually. I mean, we're hybrid working, flexible working is now given in almost every culture. You know, partly from home, partly from a central office. Maybe we're investing a bit more in our families than we did before. All of that has begun to change as a result. I hope we don't forget those 2 years. And they were, you know, scary years for quite a lot of people before we got the vaccine. And I think, you know, maybe it made people, well, we did. We had the Great Resignation. People having 2 years to reflect on their life and saying, you know, I know lots of senior people in the UK and Europe who just said, that's it. I'm fed up with corporate life. I'm not going to do that. Or I don't like the organization I work for. Or I don't like my marriage. Or I don't, you know what I mean? They reflected on their life. And that's why we've had the Great Resignation. And we've had people changing careers, going to a different organization because it's a nicer place to work. Deciding not to live in a big urban area and to move out somewhere else because they have the technology to be able to work flexibly. So lives have changed as a result of that. And I hope we don't forget. I don't think we will, because that was quite a long period of time. It had been different if the pandemic had been, if the virus had been one that we could have sorted out in a month or two.
Yeah.
But we didn't. And we still haven't. I mean, look at China today, for example. Right? They're still locked down, much of China.
Yeah.
So we have all those kinds of issues. I think it's been really good. This reset that we've had from the pandemic has probably been very good for us. Organizations now taking well-being much more seriously than they ever did before. How do we create a culture so that we can retain talent? So in the UK and Europe, what we have now are companies appointing directors of health and well-being, reporting to the HR director or to the chief executive, whose responsibility is to create a culture where we retain the millennials and the young, the Z generation. How we create the right culture so they don't just say, forget this, I don't want to work here, I'm going somewhere else. How do we look after people's health and well-being? Because ultimately they'll deliver to the bottom line if we do. Because the evidence is mounting that that is the case. You treat people right, you don't have to work them, 18 hours a day.
Yeah.
And I think it's changed a lot of attitudes this period in a very healthy way. But maybe we needed this reset. Maybe we needed time to reflect on how we live our lives, what we do at work, whether we enjoy work, whether we enjoy our relationships, whether we're living in the right place, in the right country, in the right part of the country. I mean, everybody has had a lot of reflection time.
Yeah.
And I think that's been really healthy. And certainly it's changed the nature of work pretty dramatically. And it's still changing now.
Yeah. So in our culture, we have something saying like, until you lost your cow, you start building up fences. So that means when things happen already, we start to look at the preventions. And as you've been sharing with us, catastrophe is happening in the, in our humankind up and down. After the war, people start building up peace, and then they forgot about it, and then they try to get corrections. Same for us. Right now, we are trying to make a better well-being because of after pandemic is a big impress, big kind of like scar into our mind and our generations. So how can we help to extend it a bit longer so people won't forget what happened? It
Well,
seems to us we may.
yeah, I agree with you. I totally agree. Will this just disappear and we go back to life as normal? I don't think we will, actually. I noticed, for example, we're about to enter a world recession.
Yeah.
Okay. So everybody knows where we're going now. Okay. You would have thought, given that worry about job loss, job security, that people would actually be returning to the office in big numbers to show FaceTime. Presenteeism again. But they're not actually. They're still working partly from home, partly from a central office. They still want that. They want to be with the family. They want good quality of life. So they don't want to commute in all the time into the big cities. So, but you know what I think the big driver will be? It'll not be the 40-year-olds and 50-year-olds and 60-year-olds who will continue this trend. It'll be the millennials, the young millennials and the Z generation, because everybody calls them, the American term is snowflakes, that they're the generation who, if they don't like their employer, will go to another one like that. They won't worry about their mortgage, that I owe this, I have to, their parents' generation were accepted bad work. They accepted a poor quality of working life to pay their mortgage off, right? This generation will not do that. This generation, number one, can't afford to buy a house anyway, so they don't have the commitments around their neck that their parents had. And not only that, they have a different attitude. Their attitude is, I like working, but I want to be valued. I want to be trusted. If I want to work flexibly, I'm allowed. I mean, I don't want to be an exceptionalist. That is to say, I don't want to be, say that I want you to do all these things for me, but I want a good psychological contract between me and you, the employer. I want you to trust me, value me, give me some autonomy and control over my job, and I'll deliver for you. Make work more fun. Make it something where you actually truly do what the HR people always say. HR people always say the most valuable resource we have is our human resource. But they don't necessarily action that.
True.
And that's what I think we need to do. We need to actually listen to our people, take note of what they say, and create the right kind of cultures. And it's not just about ping pong tables and sushi at your desk and massages. That's not well-being. Well-being is providing people with the quality of working life, flexibility if they want it, not a long hours culture, giving people control and autonomy over their job and consulting with them to change the nature of the work environment and make it a good place to work. That's what I think the future will be. And it will be driven not by my generation, not by the 40-year-olds, the 50-year-olds, the 60-year-olds. It'll be driven by the 20 and 30-year-olds.
Yeah.
They're the ones who are driving it. And that's what they want. And if you want to get those people and you want to retain them, then you better change. Absolutely. Otherwise, you won't get the talent.
Well, Cary, I also want the leaders to remember this and remember this longer. So we want to go back to the root of the basics of us, right? So when you and I and Vivian were young, we really cared for one another, right? We cared for our colleagues, we cared for our friends, we cared for the people around us, like wholeheartedly. But when we grow up and start working, that level of care dropped, along the way because of the setup of the works or whatever it is. So there is something wrong within the system already. So and then we've been in that for so long, so managers and leaders became robotic within the systems, and that is how the way it is and for a long time kind of mindset, right? And if we want to create like a cultures that promotes well-beings and create a welcomeness for different generations in, then we need to know why we fail at the beginning, forgetting about like why we care for another person. So what happened
That's
to
it.
us? Yeah, what happened to us though?
Well, I mean, I can say this as a dual citizen. So I'm an American British citizen, right?
Mm.
So born and raised in the United States, took British citizenship up 20 some odd years ago, 25 years ago, but have lived in Britain for 50 years, right? So I know about Europe. I know and I've come from an Eastern European background as well.
Mm.
Okay. I think what we did in the 80s, 90s, we Americanized the rest of the world.
Yeah.
Multimedia. And Americans in that generation were very workaholic, very command and control.
Mm.
Bottom line, I'm sorry, we don't like you, Vivian, you're fired. You got 2 weeks notice, goodbye. Here's your 2 weeks, right? Now, in the UK, if you tell an American, when I was growing up, when I was a young man here in Britain, I would go back home to LA and I'd say, God, they have something called redundancy pay. So if you've been working for a company for 20 years, you get a month for every year you worked with them by law, whatever it is, whatever the law was at the time.
Mm.
In other words, you don't just do like the Americans do. I'm sorry, Vivian, you're gone. Here's 2 weeks pay, goodbye, leave. No welfare, no substantial welfare, depending on what state you're in, of course, in the United States. But no welfare state, no support systems, no national health service. So you have to have private medicine, and most of your medical coverage was through your employer. So if you lost your job, you had no coverage.
Yeah.
That is the American way, try to survive. Survival of the fittest.
Mm.
And I think in the 1970s and 80s, I think, given the multimedia age, the access to American television and media, I think it influenced the world.
Mm.
That the way to go is go the American way. I'm glad to say I think Europe did start moving in that direction. No question. Certainly Britain did.
Mm.
But it still kept a health service, a national health service, free at the cost for all people. Healthcare. It might not be the best healthcare in the sense we haven't invested enough in it, but it's there. There's a safety net. And most European countries have a safety net for their employees and for their population generally, for the health and well-being. So I think we went astray. And then I think gradually, even the United States began to change, but not greatly, as we saw when it had Trump. But let's not go there. So the United States is a very complex place. And I think a lot of countries were influenced by that. You can have anything you want. Just kill yourself at work. Kill yourself. Work all hours God sends. Manage people that way. Treat them as disposable assets. And I think that influenced quite a lot of the world. Yeah. And because they're a multimedia age, because they're Hollywood. I mean, they make films. They make television programs that goes globally. Right. But I think gradually the world started to change and the European Union was developed and had its own value systems and what you should do. And unfortunately, the UK left the EU, which is an unfortunate, in my view, disaster for the UK. But I have a feeling it'll come back into it again in the next few years. I think it realizes it made a mistake. Let's hope it has. So I think really the rest of the world is in it, as said, we have a different culture than the US culture. We have to do what's right for our culture, our value systems, whether it's Vietnam or Taiwan or UK or any country or Ukraine. Ukraine's fighting for their life. And this is good. In a way, you're clinging on to what you hold valuable. And I think we're growing up.
Yeah.
The rest of the world is growing up, and it's not all about GDP.
Yeah.
And I remember once there was a speech given in 1968 by a guy who should have been president of the United States if he hadn't been assassinated, Bobby Kennedy. And he gave a speech 2 weeks before he was assassinated in Los Angeles. And the speech was called Gross National Well-Being. And his speech we gave at the University of Kansas said, we concentrate too much on gross national product, gross domestic product, as an indication of our society being a successful society. And he said, that doesn't make our success. What makes us gross national well-being? That we look after people, that we're kind, that we provide people with health care, that we care about them, that we care about our employees in the work environment. And it was a very powerful speech. Unfortunately, 2 weeks later, he was assassinated. But it was a call to arms about, and we do have countries like Bhutan, and there's a whole load of countries now where they are talking about gross national well-being, a good indicator of a society, not gross domestic product.
Yeah.
And I think there's a move about a different kind of way of thinking, and that everybody's different. So Vietnam is different from the UK. You have value systems, you have a culture. You want to retain that and not be overly influenced, like we don't want to be over-influenced by anybody.
Yeah.
Unfortunately, Britain went too far, and when it came to the EU, but that's another matter, and I don't want to get into the politics of that. But I like when countries and when companies understand the value of human beings, and the fact that they actually can produce to the bottom line if you create the right culture.
Absolutely. Cary.
And that's what drives me to keep doing the work I do.
Beautiful. Cary, a lot of management and leadership practice that we've been accumulating through the experience and the school systems over the years, is proving inadequate. Many a part of that with the new way of changing, right? So, but I believe that leaders are good people, that they always have a good intention to create something good, right? So if they want to promote a culture of well-being and start to put their people in the center of of change, where's are the baby steps that Vivian and I could do, so that we can build that culture up, Cary?
Yeah, there is something you can do. So I run in the UK something called the National Forum for Health and Wellbeing at Work, okay? It's made up of HR directors, chief medical officers, and directors of health and wellbeing of 44 global companies. Microsoft, BT, Shell. They're very senior people. And they came to me 5 years ago saying, we want to change things. These are top people who you think would not have the time. And we meet regularly every 6 weeks. And we meet at a headquarters in London. And during the pandemic, we met monthly online for an hour talking about what we should do for our employees. These are HR directors, chief medical officers, senior people globally. All right. We've come up with a plan. We think we know what has to happen in this space. Number one, all organizations in the private and the public sector ought to have a non-executive director on the board who's responsible for employee health and well-being. Because in Europe, for example, and in other countries where we had this gender pay gap, do you remember that?
Yeah.
Where women get paid substantially less than men, about 20%, depending on what country you're in, between 15 and 30% less than men doing the same job. Once we started reporting the gender pay gap by law, and the board had to do with it, the pay gap narrowed dramatically. So we need somebody on the board of private companies, of public organizations, right?
Yeah.
Like government departments, local authorities, health hospitals, everybody, should have somebody who's responsible on the board to look at the metrics about our employees job satisfied. My employees, let's find out their job satisfaction levels. Let's look at whether they are leaving the company, labor turnover. Let's look at the stress-related sickness absence. You can collect these metrics. We do it now in many companies, not a lot, but I should think about 1 in 5 companies in the UK now look at metrics. You know, what's our level of job satisfaction of our employees? What's our turnover? Are people leaving? Why are they leaving? Is it the young people going? What's our sickness absence rates like? What's the presenteeism rates like? People turning up to work but delivering no added value because they're frightened of not being at work, showing face time. So you get the metrics, and then the director, the non-executive director on the board, is responsible for reviewing that with the board on a regular basis, quarterly, looking at it. And then there should somebody in the HR department whose job is called, we have a lot of those in the UK now, Director of Health and Wellbeing, reports to the HR director. That person helps operationalize. So the non-executive director says, we just look at the turnover. We just lost 20% of people in that division. Why? What the hell's going on? We can't afford to lose good people. That person goes down to the Director of Health and Wellbeing, who then says, I'm going to find out why, and we're going to do something about it. That's how you change a place.
Okay.
But the board has to be responsible. The board, if they really believe the employees are valuable and important for getting the productivity and performance out, then look after their health and well-being, and you'll get it.
Wow.
But unless it's strategic, it won't work. Bean bags, ping pong tables, sushi at your desk, and the well-being day with smoothies is not the answer for well-being. It's nice. I enjoy it. You know, I like a well-being day at the University of Manchester, but it is not well-being. It's not strategic well-being.
So having a member sitting in the board, and the job is to make sure that they look at the figures, look at the metrics, and create a program that have increased the well-being. But Cary, if we look at the what happened at the moment and in the upcoming months, right? It looks like that the workforce is going to have another hit, and that testing the strength of mental well-beings for employees also. So over the past 3 years, we do a lot of things to promote well-beings and try to show the good side of the employer. But the mass layoff is about to happen. It had been happening, in certain companies, certain countries, and and leaders start to look at people at figures again, as number again, right?
Yes.
And
that's my worry. That's my worry too. I'm worried, like you're worried, that maybe we'll regress back.
Yeah.
But you know what? I know from the organizations I work with, my national forum, that is not the case. These organizations say more than ever we need it. I'll tell you why.
Yes.
Because we have to retain the talent. And if we don't retain the talent, yes, people will lose their job in this recession. We all know that. But if we do the right thing and talk to our employees about how we get through this together, you might not need as many job losses as you think you need.
Yeah.
So, for example, during the finance crisis, there were companies who said, "Oh, this is bad." Remember the financial crisis, 2008 to 2015, was horrible globally. Probably it was more like a depression than a recession.
Yeah.
It was so bad. Okay, so you know what the good companies did? The small number of good companies will go to their employees and say, we're in trouble. We have to keep our labor costs down because this is a big crisis. What should we do? What should we do? Not from on high saying, I'm going to get rid of 15% of people. And the employees in some of those companies said things like, we'll take a hit. Pay us 80% of our salary so we can retain the rest of the people. Don't get rid of people. Let's work together on this. So if you create the right culture, you won't get people striking. You won't get people frightened to death and, showing presenteeism, turning up to work all the time, staying long hours and damaging their health because they want to show FaceTime. I think people really forward-looking companies and public sector bodies are saying probably more than ever, maybe we didn't learn from the recession of 2008. And we lost a lot of people and then couldn't get them back in because of the way we treated the other ones who would want to now come back to work for us when the recession disappeared. So you have to think, how do we retain the good quality people we have? And employee voice is really important. How they perceive, and finding out how they perceive the difficulties ahead. What can we do to change? What can we do to minimize the job loss? There will be job loss, inevitably. I'm not naive enough to think we're going to get away with this. But it doesn't have to be a major one, and it can be solved by working with your employees. But that requires the right kind of culture to do that.
Yeah, well, thanks for sharing that. I think that if we collaboratively to find there will be better options for employers and employees in this coming years with the challenges that companies going to face, right? And if that happens, then I think that the well-beings will go into the next level because the people start to build trust again on the system, on the culture, and on their leaders also. So,
exactly.
Professor Cary, I have two last questions for this conversation today. Okay, and the first question is the one that my wife and I are on the quest to figure out the answer for that, and that is about thinking. So we believe that our thinking capability these days is diminishing. So if we have experts joining our show, we will ask this question: How have you been helping you to improve your ability to think over the years, Cary?
It's a very good question. I'll tell you what I thought. I thought my own view is that the pandemic was good from that point of view. We were forced, in the UK, for example, in Europe, and probably your country as well, we were locked away for a long period of time, more or less off and on for 2 years. That gave a lot of people reflection time, thinking through, what do I want to do? What should we do about the problems we have? What am I going to do with my family? How am I going to help my kids, my grandkids? I thought that helped me. That period of time gave me a lot of reflection time because I wasn't going on trains or planes. I wasn't going to meetings. They were all virtual. Gave a lot of us a lot of time to think. The sad bit is I think we're coming out of that. The last 9 months, let's say, and back into the, more flexible working, more hybrid working, but nevertheless, we're going back into the work environment in a big way. And I think we need to find space from time to time to reflect on the way we work, what we're doing with our lives. Are we happy with what we're doing? Are we happy with where we are? And being much more open with one another in the work environment, because that's what you do. You talk to other people. I just hope that we've learned something from the pandemic to the extent that we're more open. I've noticed so many CEOs in the UK have talked about their depression. We've had a major, and I think that's been good news. I think the good news when Antonio Herrero at Lloyd's Bank a number of years ago started to talk about his depression, when we had the chief executive of BP talked about his lifelong depression. People opening up is a way that we can then start thinking about things and talking about things that are important. So being open, and I know in the workplace I don't know if you have this in Vietnam, mental first aid in companies where company employees are trained to listen to some of their colleagues and talk to them about their issues. And that's a step forward, trying to open up. The more we open up, the more we think about life, the more we think about things, the more we communicate, the stronger we become with our work colleagues.
Beautiful. Wow, beautiful. I thank you for sharing that. It's always the find space in time so that we can have reflections and then we can think about thinking also. And then the second is be more open, so we can be more open to ourselves. Then we can attract more information, more help, and then we can we can think better through that. So that is we're gonna share that with our audience of the show. The last question we want for you. I normally we ask the question about the future, but then in my group, my boss texts me and say, make sure that you ask Cary uh, how was his experience meeting the Queen. So I need to alter my last question, so that's because not a lot of us has that privilege to meet the queen, right? And be you've been knighted by her for the for your contributions into the social science, so that is very great honors, and it's you well deserved for that. So please tell us, how was that experience to you, Cary?
Well, I think for me it was probably more important than it might be just for an average British person who's been born and raised here, in the sense that I'm a foreigner. I was an American. My parents were Eastern European. I came to this country in 1964, and you can't get a bigger honor than a country saying to you, this is our top honor. We want to thank you for all you've done for us. I can't even tell you. Even thinking about it makes me want to cry, because it meant something personal to me. It was my acceptance in this country. And she was great. I mean, she was wonderful. And when she heard my American accent, so as I went up there and I stood by and she heard my American accent, she says, where do you originally come from? And I said, I originally come from Los Angeles. She says, and why did you come here? And I said, because I love this country. I love what it stands for. I love it. It has a national health service. It looks after people. It takes care of people. He says, wonderful. Thank you very much for everything you've done. Can't get it better than that.
Wow.
It was only a minute or two, a couple minutes with her, but she got the message.
Wow.
And she was lovely. A very, very lovely lady.
Cary, thanks a lot for doing so many great things for the world, for through the works that you do, and for pioneering the well-being, because that is important part of of living, right? So we live to be happy, and work is a part of our life. That part has to be integrated in a way that make us feel worthy going out of our home, going to the office, and contribute our best. So your works help organizations to change and to create something that can that can build the future of every generation coming in, and can find the meaning in their works. All right, so we really appreciate that. We learn a lot from you, and we wish you all the best, everything great to you, so that you can continue expanding your influence, your works continue to go farther onto many other countries and many organizations, so that together that you can help them to be a better place for everybody. So thank you very much for.
Well, thank you. I've really enjoyed talking to you too. It's been fantastic. I'd like one day to come to Vietnam.
Please. Now you have,
and I will.
You will have.
I will.
You have a new friends, a new families, and we will. So
I will. I will. I will come to your wonderful country. I know lots of my friends, and even one of my daughters has been there. So I will come one day.
Wonderful, wonderful. We are here. Let us know in advance. Okay.
Okay. Thank you very much.
Thank
and
you.
I've really enjoyed today.
Thank you very much.
Thank you, sir. We wish you all the good health and all the blessings.
You too.
Have a wonderful week. Say hello to your loved ones.
You too. I will indeed.
Okay. Bye-bye.
Bye-bye. Bye.
Vivian too.